This is the ScholarLynk news for 22nd December 2020. 13 people who had COVID-19 and were classified as imported cases may have been infected after they arrived in Singapore. They were serving their stay-home notice at Mandarin Orchard. Guests have now been progressively checked out of the hotel, and about 500 staff are being tested for COVID-19. The reason the 13 people are suspected to have been infected in Singapore is because they flew in from 10 different countries but have been infected by coronaviruses that have high genetic similarity. This implies that the infection came from one source. Also, the guests all served their stay-home notice in the same tower of the hotel between October 22nd and November 11, and were confirmed to have COVID-19 between November 2nd and 11. Experts said that the incident is unlikely to spark a wave of infections, as more than a month has passed since the guests were confirmed to have COVID-19, which is enough for 2 14-day incubation periods. Think about it. Would it be better to spread out people who are serving their stay-home notice instead of putting many of them in one large hotel? Is this logistically feasible? As the number of active COVID-19 cases hit more than 15,000, major Malaysian hospitals are facing outbreaks among their staff. Klang General Hospital has seen over 50 of their staff being infected, with 3 other hospitals having 29, 15, and 10 cases among its staff. These hospitals serve densely populated areas in Malaysia. The Health Ministry has confirmed that there have been 1,359 infections among healthcare workers since the third wave of infections in September. Another 1,697 healthcare workers are under home surveillance and are under quarantine for at least 10 days. The spike is believed to be linked to the increase in community transmission. However, the cases in all hospitals are under control and health services are being provided as usual. Malaysia's total number of cases has crossed 90,000 and the death toll due to COVID-19 is 432. Think about it. The fact that frontline healthcare workers are integral to controlling the pandemic should be reason enough that they get the vaccine first. Who do you think are the next group of people who should be in line to receive the vaccine? China's Taijiquan was recently added to Unesco's representative list of the intangible cultural heritage of humanity. UNESCO has described it as a traditional physical practice characterized by relaxed, circular movements that work in harmony with breath regulation and the cultivation of a righteous and neutral mind. Taijiquan originated during the mid-17th century in Henan province and is currently practiced throughout the country by people of all ages. It has developed into several different styles, named after a clan or master's personal surname. The different styles are passed down through the master-apprentice model. Now that it is placed on UNESCO's list, Taijiquan's orthodox roots have been clarified and will help combat controversies caused by counterfeit Taiji masters, who try to promote themselves through the use of gimmicks online. At the same meeting by UNESCO, the Wang Chuan ceremony of Fujian province was also added to UNESCO's Intangible Cultural Heritage list. Think about it. Is there a practice in your country which you feel should be added to UNESCO's list? If so, why? The United States Food and Drug Administration has authorized the emergency use of a COVID-19 vaccine developed by Moderna and the National Institutes of Health. In clinical trials, the vaccine proved to be 94.5% effective in preventing COVID-19 in the 7 weeks after the second shot is given. The Moderna vaccine uses the same type of technology as the Pfizer-BioNTech vaccine, which was authorized earlier and has been administered since last week. However, Moderna's vaccine can be shipped to many locations as it doesn't require ultra-cold storage. With more vaccine options, up to 20 million people could receive their first dose by the end of the month, and up to 100 million people could get it by the end of March. The COVID-19 pandemic has now claimed more than 312,000 lives and is the leading cause of death in the United States. Healthcare workers and residents of long-term care facilities will have priority to receive the vaccine. Think about it. Is there any way the authorities can help speed up the approval process of other vaccine candidates? Would it be the case that if the approval is given too quickly, the public will not trust in the safety of the vaccine? Nicknamed the Body, Robert Lewandowski has claimed FIFA's The Best prize for the year's top player, beating out favourite superstars Cristiano Ronaldo and Lionel Messi. The Polish striker from Bayern Munich also ended the season with a European Champions League medal. Lewandowski has already scored 18 goals in 17 games this season. He has also been the Bundesliga's top scorer for 5 of the last 7 seasons and finished this season as the Champions League's top scorer. Lewandowski was spotted at the age of 21 while playing in the Polish league and joined German club Dortmund in 2010. He is known for his disciplined approach to nutrition and training. His wife Anna, who is a former Polish karate international, serves as his personal trainer. Think about it. What is more important, getting stronger as a player or getting fit in a way that prevents injuries, thus allowing one to have more playing time? This brings us to the end of today's edition of the ScholarLynk News. Please remember to subscribe and click on the bell icon to be notified of our new videos. As always, this is the ScholarLynk team saying goodbye and wishing you a wonderful rest of the day.